Hello, everyone, and welcome again to Chamber Chat. We're glad to have you again with us. As every Tuesday and Thursday, we seek to bring you information that you can use in your business to make things better for you and your business during this COVID-19 pandemic. My name is Carol Guess. I am the proud chair of the board of directors for the Greater Houston Black Chamber of Commerce. And today we are blessed to have Dr. John Williams from Albany State University and HBCU in Georgia. Hello, Dr. Williams.
Hi, how's it going?
It's going great. And today we're going to talk about the impact of COVID-19 on the African American community and hopefully dispel some myths, give you some information that you can use and take back to your families and to utilize in your business. So first, I'll start off with a little bit about Dr. Williams. Dr. Williams is a native of Albany, Georgia, and a graduate of Albany State University, where he received his Bachelor's of Science degree in biology. As a Gates Millennium Scholar and Bridge to Doctorate Fellow, he attended Florida State University, where he received a PhD in cell and molecular biology. This is a very, very smart person. His graduate research focused on molecular mechanisms of cardiac contraction. As a faculty member at Albany State, his research focuses on cardiovascular physiology and environmental factors affecting public health. In his spare time, Dr. Williams loves to spend time with his family and to travel. With his wife, Adisala, and as a member of the Traveling Medical Missioners, he serves as a sexual health educator at domestic and international health fairs. So this man is very smart and very busy. So we appreciate the time he's taking with us today to help us get a better understanding of COVID-19 and how it impacts our community. So we'll get started with our very first question. What do we know about where COVID-19 came from, Dr. Williams?
Okay, so good question. First, let's start by saying that COVID-19 is a virus that's in a family of viruses, right? And so this particular family of viruses is known as coronaviruses. Coronaviruses actually have their earliest ancestor at around 8,000 BC. So this family of viruses has been around for millennia. And that's important for us to note because there's some information from the historical past and what we know about the past versions of these different viruses that can help us in treating this current virus. Okay? So now, since 8,000 BC, it's thought that this virus and the family of viruses have co-evolved with birds and bats. So birds including fowls such as chicken, ducks, and so forth, as well as other birds. But bats in particular are important because bats are mammals. And if a virus can affect one mammal population, it's an increased likelihood that that virus can possibly jump from that mammal system to another mammal system such as humans. Coronavirus was first identified in humans in 1960. And the reason why that's important is because a lot of people have been looking at their Lysol cans and they're wondering, why does it say Lysol can prevent coronavirus if we're just finding out about it? Well, we've known about coronavirus as a family since the 1960s in humans and since the 1930s and 40s existing period. But that doesn't mean that it hasn't been around for years. And so it may have been identified as other things. What I mean by that is coronavirus in general causes a mild cold. So if you've had a cold, even a moderate cold, if you've had a cold, there's a chance it was either a rhinovirus or coronavirus. You may have come into contact with a coronavirus before. Now, coronaviruses are divided into 4 different categories or 4 different families. They have alpha coronaviruses, beta coronaviruses, gamma coronaviruses, and delta coronaviruses. Beta coronaviruses are the ones that cause the most severe respiratory infection. This family includes SARS, which had an outbreak in 2002, MERS, which is Middle Eastern Respiratory Syndrome, which had an outbreak in 2012, 2015, and I think 2017. And so all of this leads us to COVID-19. COVID-19 is another member of the beta line. So this is one of the viruses that can cause severe illness if it gets a chance to make it down into your lungs. It is thought to have originated or at least transferred over to humans from Wuhan, China. But that part is still being reviewed. It's been generally accepted that it started in China, but it's still being reviewed as to how it made it into the human population. There was the idea that it may have come from consumption of bats, which would make sense based on the evolution of the virus that I mentioned earlier. But there are other ways that it could have possibly jumped into humans. The same way that SARS and MERS didn't necessarily come from bats; they came from other animal species, but were able to jump to humans. So the current idea now is that this particular virus strain started with bats, and consumption of bats made it jump to humans. But there are some other possibilities of where it possibly could have come from.
Well, the idea that a virus could jump from a bat, it's a little concerning.
Okay.
Because when I think about the consumption of meat in general, you think about chicken, you think about beef, you think about seafood. I think it's kind of it may not be shocking to some of our viewers, but for me, I never really think about the fact that what I'm eating could contain a virus that could kill me.
Right.
And so I guess it's really important for us to, just kind of recognize how viruses travel from the animal kingdom to humans. And so in saying that, do you think that purchasing organic meats or anything along those lines would assist us in not contracting viruses?
So I wouldn't go that far. And the reason why I say that is because when we use the word organic, and a couple of other key terms that are out there, genetically modified.
Because when
Right.
when we say things like consumption of bats, immediately people will begin to think, or I would think they would think, well, if I eat something organic, I don't have to worry about that. Or if it's been processed a certain way, I won't have to worry about that. So please explain it.
So organic simply means that there are certain levels of processing that a product has to go through in order to be labeled organic, right? But those levels of processing can vary depending on the state as well as depending on what the product is. Organic, generally speaking, is just a term that says it was processed with care. With a couple of extra steps to it, and I don't want to get too deep into the technical pieces of it.
Right.
But what I am saying is organic is good, but it isn't necessarily the cure-all for what people are seeing, because we see places that sell organic products and they still develop E. coli and other bacterial infections and so forth. And I want to remind you that as of right now, even around you right now, there are pathogens on everything that you're touching, in the air that you breathe, and so forth, that's trying to get inside of you. Our bodies do an excellent job of fighting off these pathogens every millisecond. So even if you consume regular foods, chances are you're not going to get sick because of this, unless there is a particularly strong and virulent strain of whatever the pathogen is. Usually that is taken care of through cooking methods. That's also taken care of through processing methods. However, in the event that you have certain pathogens that can get past those methods, that's when you start having recalls on your spinach and recalls on your lettuce and so forth. So I don't want your viewers to worry as much about it. This particular virus, and this virus is considered to be a zoonotic virus. Zoonotic means it jumps from animals to humans, right? This particular virus I wouldn't say it's the norm. Let's just put it like that. It's not something for you to run and worry about the foods that you eat. Most of the practices that we utilize in terms of how we prepare food do a great job in terms of getting rid of these pathogens. That's the reason why you haven't really heard of any cooking suggestions or any food suggestions in terms of how to prevent COVID. Because generally speaking, the way that we prepare our food normally in the US will take care of most, if not all, of those pathogens. So I don't want your viewers to really worry. This was particularly at what's called a wet market, which means these were animals that were taken directly from the source of where they were located and cooked on the spot and provided on the spot. A lot of these exotic food places may have these wet markets where you can get an animal that's living, kill it, and have it cooked for you right there in front of you. So that's different than what we typically see here in the U.S.
And what do we typically see here in the United States?
In the U.S., most of the food, unless you raise your own food, unless you have your own ranch, you grow your own foods, most of our foods have to be processed and go through regulatory controls before it gets to us. Now, we do have farmers markets that are a little bit more localized, and those produce and products are typically coming directly from farms to the table. And that's fine. There's still a level of government oversight that has to be provided in order for these foods to be consumed and be ready to be consumed by others. So we either grow our own food, which means you can kind of monitor and control what's going on with food that you consume, or we're getting food from most sources that have some sort of oversight that'll help us make sure that we're consuming food that should be good for us. And we also have on the back end those same governmental entities that are reviewing to make sure that if something goes wrong, we recall it and try to minimize the impact it has on the community. So we have some safeguards in place that aren't present globally. They may not be present in certain parts of the world, but we do have a lot of safeguards in place to help us out.
Okay, and that's good to know. And thank you for explaining that, because most of us are not in the food industry and
Right.
don't have access to this information. So we can at least rest assured that we have some controls in place here in our country that can assist us in not getting sick. So
For the most part, yes. And keep in mind, my wife is the cook in the house, so I have to rely on her understanding of the quality control that goes into providing us food as well. She does a great job. She usually is really good about picking products and companies that have excellent oversight and that take good care of their product and don't have a lot of recall issues and so forth. So, a lot of us don't know what's going on with our foods. I'm still learning a lot about what it means to be genetically modified, what it means to be organic, what it means to be farm to table and so forth. So we all can stand to learn a little bit more about it, especially since food is something that we all have to consume.
Right. Yeah, and it's not an option, and so
At all.
this is right. And so this is definitely an eye opener for us to just, keep in mind we have to do a little bit of due diligence with regard to what we eat and how it's prepared. So going forward, we can prevent the spread of something like COVID-19 as much as we can. We do our part. There are no guarantees, but we can do our part. So
Right. Correct.
So what's the latest information that you have about a possible vaccine?
Okay. So the vaccine process is a relatively long, multi-step process. Okay. Just to kind of give you an idea of the steps that go into the development of a vaccine, the 6 general stages are the exploratory stage. That means that researchers are identifying molecules or peptides or a certain combination of materials that could show some effect against a virus, right? And then there's the preclinical stage, which is where these molecules, peptides, or agents are utilized in other systems so that those systems can give us some sort of indication as to whether or not it has some effect, right? Whether it's effective. Usually these systems are going to be closely related to us, so mammalian systems like rats or mice, or even some larger systems such as other primates like orangutan and so forth, right?
So that's why we see so many lab tests on mice.
Right. That's one reason. Their systems have enough mammalian similarity that we can look at impact and kind of speculate as to what that impact would be if we were to use those same materials in humans. But they have certain they have certain traits that work well in the research environment. For example, their lifespan is such that we can monitor the effects in a very short period of time. They reproduce a little bit differently. So if we need to generate lines of mice, it would be easier to do than generating lines of humans or lines of other primates, right? So there are a number of factors as to why we use mice and rats to look at things that will eventually end up in humans. However, that's still at the preclinical stage because they are different enough that if we see a positive effect in those systems, we have to make sure that that positive effect is also seen in humans. So once we get past preclinical stage, then we go to clinical development. Clinical development has 3 stages too, roughly. Usually clinical development has phase 1, phase 2, and phase 3. Phase 1 is essentially looking at whether or not these materials are safe. Not necessarily looking so much at the effect, but whether they are safe in the human body. So these are usually smaller trials that are testing to see will humans have a reaction to these materials? Will they have a reaction to the delivery materials that go with the therapeutic agent or the antibodies or the virus particles that are being used? So that's about safety. The second is about effect. Is there a positive effect of the agent or of the therapeutic material in the human body? And this is usually phase 2. And then phase 3 is, will this particular product work better than what we already have, right? Because if we develop this wonderful product and there's not a benefit beyond what we already have, then there's no reason to continue pursuing that.
Right.
Right. And then after we get through clinical development, we have to go through regulatory review. So governmental agencies have to go through and check it to make sure that everything is working properly. Review it for protocols that the government needs for it to have in place before it can be used. And you have to manufacture enough for the population to use. And then once you manufacture it, it has to go through quality control to make sure the product that makes it to the patient is of the best quality possible. Right now, since you asked, there are currently about 8 vaccines that are in the clinical stages. Okay? And by clinical, I mean they're actually testing them out in humans. Here, and I'm looking at my notes here, I have 4 that are actually in phase 1. So they're just testing to see if they're safe in humans. We have several that are in phase 2 and phase 3. Okay. And so what that means is these companies and these institutions, and many of these companies are partnering with institutions such as University of Alabama at Birmingham, Tongan Hospital in Wuhan, and so forth, University of Oxford. They're partnering with these other institutions to try to get these vaccines to the market as quickly as possible. But keep in mind, for most vaccines, we have to go through all 6 of those steps, including those 3 steps in clinical trials. So there's always the possibility that the fast tracking of these vaccines could have some impact on us that may be negative down the line. So that's something that we have to be concerned with, which is why a lot of people are a little bit nervous about taking the vaccine, even if it's developed. But the nature of this virus is such that vaccine development has to be at the forefront and priority of this situation. Mm-hmm. With that being said, there are 28, last time I checked, there are 28 overall trials that are going on, including these that are in clinical trials, but also those that are exploratory and those that are in preclinical trials as well. And one thing I want to share with your viewers, since your viewers are typically going to be business people, these companies that are doing these vaccines, their stock prices are going to change as well based on, how well they're doing with this race, right? And so we're going to need more than one company developing products, because if a product works in one population well, another product may work differently in another population and so forth. So we need more than one, but that may be a good place to start looking for investments. I know my wife put some money into a company called Altimmune, and within the last couple of days, her money's doubled. So this is just putting that out there as a side. This could be a time to start investing in pharmaceutical companies that are trying to develop vaccines.
No, that's a great point, and thank you for sharing that with our viewers. I'm sure we'll have um, several of our viewers go and check those companies out, and all it does is serve to create more economy within the Black community, and hopefully donations to the Greater Houston Black Chamber and to Albany State University.
Absolutely. And what we need to have happen is we need to have a seat at the table. There's a lot of money out there being made, and it doesn't necessarily take a lot of money to actually get into the market, but it does take a lot of research, a lot of studying, and it's still a gamble, but it's a gamble that many people are sustaining their livelihoods on. So it has to be part of it can be part of the economic plan for everyone if they start investing in the stock market. And one other thing I want to point out is that this is just the vaccine development, right? There are also companies that are working on vaccines, but are also working on new technologies for delivery of therapeutic agents, such as nanoparticles, which is a totally different area that has a different level of effectiveness and is also moving us into, deeper into the 21st century and futuristic type activities that can be utilized to treat these conditions. And we're also in the process of clinical trials of antibody testing. So taking antibodies from those who have already been impacted or affected by the disease and using those to treat future patients so that they don't necessarily have the exacerbated conditions that those who have gotten over the COVID-19 virus have had to deal with. So the scientific community is targeting this disease on all fronts.
And so would it be a simple Google search to find out who these companies are?
Absolutely. If you Google vaccine development and just look through it, the first couple of links will give you the companies that are working on a vaccine for COVID. And because it's the hot topic right now, most of the hits that you'll get once you start Googling vaccines will discuss COVID. If you want to be more specific and filter out other vaccines that are being developed, put COVID-19 in there. But all of this will pop right up.
Okay. Thank you for that tidbit. I'll be sharing that with our members. And so, while we're on the topic of a vaccine, unfortunately, our community has a history of being experimented on. And so, what can we do to ensure that we're not going to be experimented on with any of the potential COVID vaccines?
So I have to tell you, this is a tough question for me. As a Black man, I am very sensitive and very nervous about how we get treated in the medical field and how we are utilized in the medical field. For a while, a couple of weeks ago, there was actually some talk about taking some of these vaccines and therapies and testing them in Africa, and it was just thrown out as, oh, this is something we could do, as if we're not talking about people and people who look like me and I feel I have a connection to, right? So I have a sense of distrust to an extent as it relates to biomedical research, which is kind of contradictory since I work in biomedical research, right? But here's some of the things that I have to put out there. One, when these clinical trials are being done, if Black Americans, African Americans, and minorities are not present in the clinical trials, then some of the things that are unique to our physiology and our genetic makeup may be missed or overlooked in the process. This could lead to less effectiveness or increased side effects. And that's one of the reasons why we have to participate. The other way that we can advocate for ourselves through this process is to, one, become the researchers and help our children recognize the value of STEM degrees, right? Not just in biology, but in a number of areas that impact this. Even for example, the nanoparticles that are being used to deliver medication, a student in physics or a student in engineering may be able to help make sure that that delivery mechanism is stronger for the biomedical researchers. So there are a number of ways that we can contribute, not just in biology, but in many of the sciences to be able to help with this process. Also, there are a number of other areas outside of science where if our youth are going into these areas, or if we can start to invest in these areas, we can also have a seat at the table as many of these therapies are being developed, so that we can be in the know as to how these materials are being utilized in our communities, right? So for example, law. If you're into law and if you're into politics, then you may want to work and learn more about these regulatory boards, about some of these clinical trials, and how the FDA and other governmental agencies are regulating their procedures, right? Some of those testing materials and whether or not they violate certain human rights. We have to stop letting the game come to us, and we have to go to the game, if that makes sense. And I think that that can be done on all fronts. Everybody's not going to want to be a scientist. I understand that. But that doesn't mean that we can't stay informed. It doesn't mean that we can't share information, correct information, not just basic information that you saw on Facebook, but actually correct information. And we can utilize our spaces, regardless of the fields that we're in, and regardless of the fields that our children will go in, to help us have a better seat at the table when these types of things come about. So I have mixed emotions about clinical research and about the history of clinical research on African Americans and on Black people in general, and minorities as well. And there's a whole history, not just things like the Tuskegee experiment. There's a whole history of experimentation that has been done that we're still seeing the outcomes and still seeing some of the remnants of it today. So yeah, I hope that answers your question. But I can tell you that that question for me is a touchy subject.
Well, I see what you mean by saying that we have to participate on some level, because we do need to know how it would affect our bodies.
Right.
But having people in the field in those different positions is definitely a great way to safeguard against certain things. We may not be able to eliminate all, but we can be in the game and eliminate most things that may happen to us. So those are some great points. Thank you.
And if I may add, one other thing that we may want to look at also is, what are some of the minority institutions that are working on these conditions, and start to actually support those institutions as well, not just for COVID and vaccines, but in general, right? So Meharry, I think last time I checked, Meharry Medical College, there were some professors there that were working on how we can treat COVID-19. And some of the things that go into how COVID-19 spreads, how to prevent that spreading. Here at Albany State, without telling too much, we're working on some research that will discuss social distancing and its impact. There was another young lady, I think she's working with the National Institutes of Health. She's also a Black woman who was working on a vaccine as well. And then outside of vaccines, you have professors like Dr. Hadia Green, who is using laser technology to treat things like cancer. We have the ability, we have people who are working on all of these diseases. We have people who look like us that are already there. We need more support of them. If we're not going to participate, we at least need to be able to support them financially, informationally, and so forth. And then those who want to participate, we can increase our overall presence in the biomedical research field.
And so, speaking about that, is there anything specific that Black businesses can do to make sure that our community has adequate care when it comes to COVID, in addition to those things you've already mentioned?
Yeah. So I thought about this question when you sent it to me previously, and there are a couple of things that I could think about that I think we could possibly do, right? So one, a lot of our businesses are close to HBCUs, or at least may be able to connect with HBCUs, even if they're not physically close, right? And so our HBCUs could utilize the support, because our HBCUs are often on the front lines of trying to address issues that are in our community, but they're often underfunded compared to some of the larger institutions in our country. Give you a quick example. Here in Albany, Albany State has a number of professors that are looking at public health issues, environmental issues, and so forth. But one of the biggest institutions that does research in Albany is Emory University, that's in Atlanta. Emory University is a private institution with large amounts of resources. So they come into Albany, gather data, get their research, and do the things that they need to do, and they're able to do it without having to jump through as many hoops and jump over as many strings because they have the resources to do so. Our community and our businesses can get behind some of the work that we're doing and support our initiatives at the HBCUs, because our HBCUs need to be at the forefront of addressing issues in our community. And that's not just the historical stuff or the historical research that gets done that we see, but also the biomedical research that gets done, the entertainment industry, all of these different industries that can be utilized to uplift our community. We need to support our HBCUs as they're trying to make sure that our students and our communities are being impacted positively, if that makes sense.
Well, it makes complete sense.
And let me give a couple of quick examples. Some of the smaller businesses here in Albany, if our student organizations need a place to meet, they'll actually allow those student organizations to come meet in their restaurants or in their shops and so forth for free, and maybe have discounts on the foods and things that they offer. This is a way of connecting with the campus so that the campus recognizes the business and supports the business on a regular basis. But the business is also adding support in other ways, even if it's not financial, to the conducting of business and these initiatives on the campus, right? And so even little partnerships like that, that's something that a mom and pop store could do, but it'll make all the difference to the institution, students, and to the business itself. So little things like that could even be a way of investing into your local HBCUs.
Mm-hmm. And this goes along with something that our board decided that we wanted to do last year and introduce this year.
Right.
It's closing the gap for economics in our community. Right. Every single person who can play a role, the consumer and businesses. And what you're talking about is basically a partnership to make the community better, where you have the consumer and the students, and then you have the business, and they reach a contract per se. They compromise and say, this is what I can offer you, this is what I can offer you. And in general, it will help our community as a whole. It's cooperative economics. So thank you for that, because I'm sure there are listeners out there who can take advantage of that right away.
And if I may add also, a number of our businesses are in areas that when situations like COVID-19 happen, just modifying the purpose of your business may be able to help you stave off some of the loss of income, right? So for example, if you own a dry cleaning business, minority-owned dry cleaning business, well, we know that not a lot of people were using dry cleaning during the lockdown, but a lot of hospitals, they have had materials that you could help clean and refurbish it or reproduce for those who are working in essential conditions, right? And so, provided that you take the appropriate steps to provide protection for yourself and so forth, that could be a way for you to contract with some of these doctors' offices, with the hospitals and so forth, to keep your business thriving. If your business is one that requires sit down or sit in to dine, and now no one's sitting in and dining, then moving to a delivery aspect of your service and so forth. Some of these creative ideas of helping to repurpose what you do for the condition at hand will allow you to stave off some of this loss of revenue during this time.
Right, and several of our businesses have pivoted in that direction. Good. Where they're trying to minimize the effects of the economic effects of COVID. And speaking of that, as we wrap up, wanted to ask you about ways businesses can help to protect themselves and employees as we go through the reopening process. You know, here in Texas, we have a 25% club, and I believe 50% restaurant occupancy. You have to be, you know, 6 feet apart or whatever inside the establishment. You know, what are your thoughts as far as being realistic about keeping your employees and your patrons safe?
Got you. So there has to be a comprehensive plan in place, and hopefully our businesses were looking at this during the closures, because as of right now, as things start to open back up, it's going to end up being, you know, every man for himself, God for us all, in terms of the businesses that are available. And the businesses that have revenue, you know, kind of backlog, that have been making money, are going to probably be able to survive these kinds of times. But businesses that are just getting off the ground, they're the ones that are going to have the most strategic plans in order to make sure that it's not grand opening, grand closing. See what I mean? Couple of things that I think can be done. First thing is we have to still maintain social distancing. For the near future, if the workers can wear masks and clean the areas of the business that are high contact areas on a regular basis, that'll help reduce the likelihood of the spread of the virus. And that's something that, you know, has been suggested by federal government agencies, state government agencies, and so forth. So all of those practices are pretty strong practices, and something that we should do in the near future and for the foreseeable future, right? Even after this epidemic is done, there's nothing wrong with increasing the cleanliness of a business, or increasing the amount of times that you wipe down high contact surfaces. So all of that is one thing. Second thing is, and this is going to be the financial piece, we got to find a way to provide better health care for our workers in some of these service level jobs and entry level jobs. If your job doesn't come with insurance, then you're putting more people at risk than just your employees. And here's why. Many of the people who are suffering from COVID-19, particularly in working class families and low income families, are balancing the idea of, do I go to the doctor and get this mega bill that's going to come, but I do so in a way that can prevent me from getting sicker? Or do I wait it out until it gets to the point where it's just too much for me to bear, and at that point go to the doctor because I really have no choice, right? Well, during that time that you're waiting this out because financially you can't afford to go to the doctor, you're still coming in contact with other people. So the access to healthcare means more than just the individual who gets sick, but it also means, will this person, especially with COVID-19, will this person be a danger to others because of the inability to go to the hospital? You see what I mean?
Right.
So we have to find ways to provide healthcare, or help our employees and workers get healthcare as well, access to healthcare. And so that's going to be key. Several of my students, for example, I know that they got sick, but they didn't want to go to the hospital until their breathing was impacted because they just didn't want to bill. A lot of students may not have adequate insurance to cover, you know, the types of testing that goes with COVID and so on. So there's that piece. Also, one of the things that I'm a proponent of, and it's an idea that I utilize with my projects and initiatives, is future proofing. Once you see what has happened, then you start to anticipate, okay, if this happens again, what will we need in place to make sure that this doesn't cause the same impact, and start addressing those issues now. Because the next epidemic could be in the fall, it could be 10 years from now. If you wait until the next epidemic comes, you're going to be behind the 8 ball again. So now's the time to strategically start identifying what was missing during this instance. What are some of the things that we could have done differently? What are some of the things that we needed that we didn't have? So that the next time an issue comes up, and it may not be an epidemic, it could be like we're seeing now, it could be public unrest, like we're seeing in other places. It could be anything that could possibly stop the business from growing. How do we protect against that moving forward? And so strategically planning, now's the time to do that in order to make sure that your business is future-proof once we get through this particular situation.
Agreed and well said. That's something that we've been advocating at the chamber also, is to take note of what has actually transpired and see, where you were caught and make some changes so that going forward, we're never in this position again. So I know we're wrapping up, but I think there's something important that we need to discuss, and that's the effect of COVID specifically on African Americans.
Right.
We've been told that it hits our bodies differently. We have underlying conditions. It hits us differently from than white folks. So what's true, what isn't true? What can we do for those of us who have not had to deal with the disease? What can we do going forward to protect ourselves?
Okay. So a couple of things. First, let me address one thing that bothers me the most, and that is the misinformation that floats on the internet about how COVID-19 affects the African American community. There are a number of factual pieces that are out there that's research based, that's qualitatively and quantitatively based, so that they're not only looking at data but also the lived experiences of those who have either dealt with COVID or dealt with taking care of those who are dealing with COVID. There's enough valid information out there that we don't have to buy into the information that's false. That false information, and in particular, some of that false information that plays on our loyalty to our Blackness. And so that kind of information can sometimes be dangerous. For example, when COVID first came out, several of my students mentioned in class, because I teach pathophysiology, they mentioned, well, we heard that Black people can't get it. And they actually thought that meant, because they saw it on Facebook and because it said Black people don't get it and it tied into their loyalty to being Black, they thought that they were immune, and so they were taking risks that others weren't taking, and some of them got sick. And we see those types of things happen. So the false information piece, we have to be careful with that to protect ourselves. A lot of the false information that's out there, especially those things that are on memes, those things that are on Facebook, on Twitter, and so forth, just fact check it by running it through Google. If you don't see it in your basic news sites or your basic institutional sites and governmental sites, it doesn't mean that it's wrong, but it does mean that you need to take it, be a little bit more careful with how you apply that information. Because there are a number of people out here who are spreading false information, and some of them are making money from it, because if it's coming from a particular page, that draws views. Some of them are just putting false information out there because they may think it's true, because it sounds like it makes sense, but it may not actually be true. And so we have to be careful with the misinformation. With that being said, getting to the actual physiology and pathophysiology of COVID-19. COVID-19 hits humans, all humans, pretty much in some similar ways. It attacks the respiratory system. If it doesn't get into the lungs, then it's pretty much going to generate a cough. It's going to generate a fever. It can generate lethargy. You'll be tired. It also can cause damage to your ability to taste and smell. And so those are some of the common symptoms that happen. It can also, in some people, it also may reduce your appetite. I know I lost my appetite for a while, but I also lost 20 pounds in the process. So that was sexy, right? But if it gets down into the lungs, that's when we start to see the development of pneumonia-like symptoms, decreased breathing, and so forth. And that typically happens across the board. Now, with that being said, pre-existing conditions can exacerbate the disease, right? Many of those pre-existing conditions include chronic lung disease. And it's interesting because asthma is a lung condition, but asthma, there are mixed reviews as to whether asthma is actually going to cause a problem with COVID-19. But other diseases like COPD, emphysema, they may make you more susceptible to severe COVID infection. Immunocompromisation, so having HIV, undergoing cancer treatments and therapies, recent surgeries and so forth, may compromise the immune system. And that could increase the likelihood that COVID will become more severe in your bodies. But the 4 key areas that I've seen so far of pre-existing conditions that are seen across the board, but more African Americans and more minorities have them, are heart conditions, obesity, diabetes, and chronic kidney disease. These 4 pre-existing conditions are prevalent in minority communities and Black communities. And so these 4 conditions then may exacerbate it in the Black community, right? And so many of these conditions have a genetic component, but the genetic component predisposes you to it. In other words, it increases your likelihood that you may develop these conditions. It doesn't mean that you will. For example, if you have a predisposition for diabetes, it doesn't mean that you will develop diabetes. It means that the likelihood of you developing it, if you don't take early interventions, may increase. So I say that to say that we can't utilize pre-existing conditions as the only explanation as to why COVID is impacting our community so much. Our community is actually impacted by a number of social determinants of health. These are factors outside of what your genetic makeup is, but they impact your genetic makeup, they impact your physiology and so forth. Things like community health. If your community has poor air quality, that can cause breathing conditions, right? So you'll often see in areas that have poor air quality, the kids develop asthma and bronchitis early, and it's more severe than other places. They may develop other breathing issues. They may develop some neurological issues and so forth. Well, those things can be pre-existing conditions that have nothing to do necessarily, or may not have anything to do necessarily with your genetics, but have a lot to do with your environment. Food insecurity. And food insecurity is also tied into income, right? So say, for example, you're a working family with a moderate income, right? Then chances are, if you're going to get food, you're going to get food that works well with your budget. Sometimes food that you can eat off for 2 or 3 days. Most of those foods look like rice and rice dishes, pasta dishes, spaghetti that you can eat on 3 or 4 days. Most of those dishes aren't necessarily nutritious for you. They're high in carbs, they don't have a lot of protein and so forth. And so that over time can lead to obesity. And I'm thinking about all the times growing up that I ate those meals and they were so delicious, but they probably weren't the best for us over the long period of time. Does that make sense?
Yeah.
And so when we tie into that, things like government assistance such as SNAP and WIC vouchers and so forth that are often used for low-income households, and they have limitations on what you can buy, you're going to try to stretch that money. And stretching that money does not necessarily mean going to Whole Foods. It may mean going to, the local low discount grocery store that may not have high quality foods, but they have foods in abundance enough for you to be able to feed your family for a longer period of time. All of these factors play into the development of diabetes, the development of obesity, and so forth. And then stress. It's been shown that stress can also increase your likelihood of getting sick. And stress in particular in the African American community has been a compounding factor in the development of some of these diseases. So if we really want to try to fix this problem, not just for COVID-19, but for all illnesses, but in particular for COVID-19 now, we have to look at more than just the genetic makeup of the person, but also look at what are the conditions that are causing these, what are the environmental conditions that are causing or exacerbating these pre-existing conditions that are in the patient before we even get to the infection.
Mm-hmm. Right, and for our community, because of the environment we've been in for however many hundreds of years, these are factors that we have to contend with. But I believe COVID-19 is finally uncovering some things in detail for everybody to be able to see and examine and correct the entire problem going forward. Not just pieces of it. We've been kind of piecemealing it here and there, but now everything is exposed. So now is a great opportunity for all of the thinkers and doers in our community to get some type of plan together to see what we will do to benefit our businesses and everyone in the community going forward. Well, Dr. Williams,
Absolutely.
thank you. Thank you so much for your time. You were just a wellspring of knowledge. And I know that our viewers and listeners will take to heart what you said and make some good decisions going forward. And so, how can our viewers get in touch with you? Should they have questions or want you to speak at some of their events? How can they get in touch with you?
Absolutely. My email address is John, John, dot Williams, Williams, at ASURAMS.edu. So john.williams at ASURAMS.edu. If you're trying to reach me regarding COVID-19 or regarding this presentation, please put in the subject line regarding this presentation or regarding COVID-19 so that I know how to focus my attention and how to address that amongst all the other emails that I get from work and so forth. I'm also on Facebook, John L. Williams, and you can look me up and add me on there as well. And those are the two main ways that I communicate with most people.
Okay. Well, and thank you for that. And again, as always, please pay attention to our Greater Houston Black Chamber social media and website. We always have COVID-19 updates, information that you can use regarding your business. So we're at Greater Houston Black Chamber on Facebook and Houston Black Chamber on Instagram and Twitter. Also, HoustonByBlack.com. Please support our businesses at HoustonByBlack.com. We have businesses represented in just about every industry that you can think of, and we need your support at this time. So again, thank you, Dr. Williams. Thank you, everyone, for paying attention. We hope you can take some good nuggets from today's talk and share it within the community. And again, join us every Tuesday and Thursday for Chamber Chat. Have a great day.